kind of the way it works. Well, then the program reinitiated. And at that time, they started looking more closely at having a manual that they could go by and so on. And really, it wasn't long after that I came back to the program in 1987. And I think they had been operational for maybe 2 years at that time, but they were building the program. There was new focus on the program. They were talking about doing training of the industry. They were talking about a number of things, a lot. In fact, one of the things that had occurred was there were a lot of ships being built pre-1982 or 83. Typically, a ship might be being built somewhere, or there may be some renovation or something like that of a ship. But building new ships was not, what it is, nothing like what it is today. So somewhere around 1982, Carnival came in with plans to build 6 new ships. This was incredible. No, I mean, I can still remember that day because I wasn't in the meeting, but Mr. Yashik came out and said, Carnival just brought plans for 6 new ships. It's incredible. Nobody's doing that. Well, very soon the industry started catching up and everyone started building ships. And so a whole new aspect of the program really developed then, the need for some guidelines and so on. So these are all kind of big bangs or things that happen. And as a result, public health measures had to be taken and public health measures had to be sort of solidified into some form of guidance so that that you would treat people fairly and equally in the application of public health principles. And so that was, and then of course, around 1988 or late 87, I guess it was late 87, they moved the program in the Centers for Disease Control from quarantine, which is what the law that it was working under, over to the National Center for Environmental Health. And this was a huge move because they were no longer attached directly to the people who, where the law, the quarantine laws were, but they still functioned under that law. But it was very different, and it brought in different levels of expertise, more environmental health expertise. And of course, they developed better guidance for both the operational aspects and for construction, because construction was growing very quickly. And then I left the program again around, I think it was 89, and went over and started as a manager in the Agency for Toxic Substances and Disease Registry, and was gone again until 96. And when I came back in 96 as a manager in the program, of course, things had changed drastically, lots more construction going on and new manuals. And of course, not long after I got there, we had to come up with a new manual. We had to revise the manual because things were changing. And it's been, and the other thing that changed over the course of this time period that we're talking about is even in the early 80s and up, I suppose, even to the mid 80s, still the infections that we were worried about were bacterial infections. But somewhere in the 80s, we started, 2 things happened, I believe. One was we started having more viral infections. And 2, we gained the capability to assess what these viral agents were.